Hi everybody, my name is Mick. I'm the Executive Director of Thrive Gulu. I do hope everyone is staying healthy and safe out there. I want to give you a quick update about Thrive. This past April, we decided to conduct an emergency appeal so that we could raise some additional funding and send it to Uganda for a humanitarian initiative in this time of the COVID-19 pandemic. That appeal turned out to be very, very successful, and we're very grateful to the many donors that supported us. And with that money, we were able to launch several important services. One of them was radio shows. We began conducting weekly radio shows for 6 weeks. 3 of those programs were on gender-based violence, and the other 3 were on mental health and psychosocial support. So, for example, we conducted a program on how COVID-19 was affecting people's mental health, specifically around depression, how being under lockdown could increase a person's feelings of isolation, loneliness, and depression. These programs turned out to be very, very popular and successful. We received 193 call-ins from listeners, which is double what we would receive under normal circumstances. So the services we were providing were very, very helpful. We also began caravans. Caravans are when we rent a pickup truck and a PA system, and then we drive into some of the most hard to reach areas of Northern Uganda, places that aren't serviced with information and with the kind of help that they need during a period of crisis. So we were able to reach 32 villages in some of the most remote parts of Northern Uganda and deliver a message of hope and healing, some factual information about COVID-19, and some ideas about just how to promote their general well-being. The villagers received us with open arms, and very importantly, we also learned about 3 very, very serious child protection issues on those trips. Our staff, our Thrive staff, were able to respond to those protection issues immediately and provide the support that the children, young children, and their families needed. We also, for the first time, established a dedicated phone line specifically for counseling. That turned out to be very, very helpful because, of course, we weren't able to do face-to-face counseling sessions. And unfortunately, one of the side effects of this COVID-19 in Uganda was a tremendous spike in the number of gender-based violence, intimate partner violence, child sexual assault cases, and so on and so forth. And so our Thrive staff were able to support 41 gender-based violence cases in the months of May and June. Again, that's double what we would normally see under pre-COVID circumstances. Now, these innovations may not sound very technologically fancy, but they are at the same time socially and contextually appropriate for the people and places that we serve. And because of that, as well as because of our tremendous success in delivering these services, Thrive caught the attention of some very big international players. We caught the attention of the World Health Organization, of the Mental Health and Innovation Network, of the Lancet Psychiatry Journal, and several others. And we were invited to write a blog. We were invited to participate in a webinar. Our fabulous country director, Dora, participated in an international webinar to share about the programs that we have been doing. And so we're very proud of the staff and of the work that we did during that time and during those 2 months with the humanitarian funding that we had. Again, we owe so much to our donors for making that possible. You made it possible for us to design and develop the programs and the services that we were able then to deliver to the people who need it most. And with the excitement that we have of sharing that knowledge and experience with an international community, we can't thank you enough. Whenever I say the words "Together we thrive," this is what I mean. Together we thrive. And I do sincerely hope that you continue thriving, and we shall too. Thank you.